My name is Jesse Jager. I'm the Director of Advocacy and Development for the Poverello Center. The Poverello Center's mission is to provide food, shelter, help, and hope to all who ask. We're the main emergency shelter for adults here in Missoula, Montana, and we serve people from all over western Montana. So the Poverello serves adults who are experiencing homelessness in our community. It's, the causes of homelessness are very varied. Every individual has a different story. Really, in these times, the issues that are facing them around COVID in particular is that people experiencing homelessness have fairly unique and significant health problems. If you're experiencing homelessness, you're much more likely to have compromised health and therefore are more susceptible to a disease like COVID-19. So we've been working really hard here at the Poverello Center to make sure that we have really good protocols in place to protect our guests, volunteers, and staff from COVID-19. This has included a couple of things. One is that we needed to create more social distancing here at the shelter. So we had to cut our capacity to do that down to 88 people to ensure that there's 6 feet of separation between every sleeping space in the building. We also had to do some radical changes to our food programs. So in our soup kitchen, we had to set it up so people could stay 6 feet apart, which limited us to being only served 36 people at a time. And so that's all been a challenge and mean that it's harder to serve a community that's really in crisis during this pandemic. What we've done to address that is a big one is we had to open up a whole new shelter for the winter to make sure we had enough inside space for shelter. So we opened up a secondary winter shelter, which has been incredibly expensive to do. That winter shelter is largely funded by CARES Act funds to help us have the resources to be able to house everybody that needs to come indoors during a cold winter here at the Poverello Center. And then we've also received CARES Act funding for helping support more robust sanitation practices in the building. So we do a deep clean of the building every day. And so the CARES Act has helped fund that project and having more staffing to make that possible. And then finally, the CARES Act fund has helped us hire additional outreach workers to work with people who are experiencing unsheltered homelessness. A consequence of COVID-19 is that more people are experiencing unsheltered homelessness. Part of that is because of the reduced capacity here at the Poverello Center, but also because people experiencing homelessness are doing what you and I are doing every day in trying to socially distance themselves and just don't feel comfortable in a congregate setting like a homeless shelter like the Poverello Center is. So the homeless outreach team is working hard to connect people who are experiencing unsheltered homelessness with resources, get them the supplies they need to survive, and then help them find and transition into more permanent housing. So we would have not been able to do any of the increases in providing services here at without the stimulus funding that we've gotten so far. The PPP program, CARES Act funding that came in through the state and the city has been critical. Frankly, it's costing us a lot more to serve our guests right now while practicing social distancing protocols. And if we didn't have these kind of supports from the federal government, we wouldn't be able to do that. And people would literally be dying on the streets right now, or we would be forced into having people packed into congregate shelters and getting COVID. So it's essential that we keep that funding moving forward. The challenge is that we've figured out this funding, but after that, we really expect that even if COVID-19 has been addressed with a vaccine, that there are going to be some really serious long-term economic consequences. All the economic issues that cause people to be on the brink of homelessness before COVID has pushed them over. And some national organizations that work with homeless communities are expecting that we could see up to a 40% increase in people experiencing homelessness over the next several years. And we need resources to be able to continue to serve those populations and serve that growing need as it happens.